I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered, bringing to you the situations that many people will encounter in their lives and helping you guide through that process by which people can make the better decisions for themselves. See, oftentimes we're just inundated with so much information out there, on the internet, other people, everybody telling you what to do or not to do. How do you discern what's going to be best for you? Because the truth is that there are many products out there or many services out there that might be perfect for you or might be perfectly wrong for you. And so it's ultimately your responsibility. You can't blame anybody else for taking the wrong pill, but ultimately it's your responsibility to figure this out. So all these podcasts out there that are really selling a product or a service, what we're doing is we're actually just sharing with you a process by which you can make better decisions for yourself. And so with my amazing guests, they present with a particular problem. And we do that through role play. This may be a personal problem of theirs or something that they're very much familiar with because of the business that they're in. And you might actually get triggered, or you might be judgmental, or you might be critical about whatever is happening on the show. And that's also partly the purpose. It's raw and unfiltered, because that's going to wake up a message from the deep that says, you got your work to do. Like what Byron Katie says, any kind of pain is our work to do. And so the final outcome, which is what I'm really clear about, and the commitment with this podcast series, is to have these candid conversations, the kind of conversations that you're not going to get anywhere else, where you get to witness yourself or somebody else that you care about in that process, and then help them be guided towards some sort of resolution. And that's what we're going to do here today. So after my two guests briefly introduce themselves, we'll do about a 6 or 8 minute role play, after which we'll simply unpack what was talked about. And then my hope is that you leave with some sort of insight or action step that you can take for yourself. If at the minimum, it's just reaching out to them and getting their help as well, because that's also a gift that we get to serve you, is you get to meet them in advance. You find out that they're super cool people, and then you're going to want to connect with them as well. So for today, Rachel, thank you so much for joining me today. Maddie as well. Rachel, please briefly introduce yourself. Then we'll go with Maddie, and then we'll go with the 6 or 8 minute role play.
Absolutely. My name is Rachel. It's a pleasure to be here today. I'm a naturopathic wellness coach. I specialize in weight and age management, as well as an emotion code practitioner, certified emotion code practitioner. I release trapped emotions, trauma that might be trapped within the body, and help people live a more healthier, balanced life.
Love that. And what's so impressive about you, Rachel, is simply this, is that, conventional medicine has a lot of answers, but it's really restricted to drugs and surgery. And you're more into the organic and natural approach to helping people optimize their health, which in my opinion, as a very well-trained surgeon, is my preference as well. So I'm almost like an oxymoron, because as a surgeon, I try to find all the alternatives that are non-surgical first, so that, we can just simply harness the potential of the body to restore form and function. And I love the fact that people like yourselves are so focused on that, using medicine as a last resort, but finding people like you first is so important, including our other guest, Maddie. Maddie, introduce yourself.
Absolutely. Well, thank you for having me. My name is Dr. Maddie Mohyla. I am a doctor of chiropractic here in Sarasota, Florida. My background is in sports medicine. I was a personal trainer as well, a competitive soccer player and personal trainer. I just said that actually, sorry, for 10 years prior to becoming a chiropractor. And it's my honor to be here again today with you all. And our tagline is adjusting the way you live. And we do that physically, mentally, emotionally, and of course with nutrition.
I love that. And so what position did you play, by the way?
Oh, I was a midfielder throughout my college career.
You're a midfielder. Well, my daughter was an amazing competitive soccer player as well. She actually played for Vanderbilt. Yes. And she was defender and captain as well. So I was super proud of her. But they kind of beat her up. I don't think they had the best chiropractors there to help them after the games.
I didn't either. I wish.
Yeah. Most importantly, for the listeners out there, and I'm gonna say this now, and that is this, is that, in the journey of health optimizing, it's the ability to stack up different elements, different modalities at the same time that really is a major game changer. Too many people just rely on one thing, one solution. But what I love about what you guys have is that you put it all together. All right, let's jump into the role play. I know Maddie has a problem and Rachel has a solution.
Yes. So going back to the soccer days, a lot of concussions that has been in my history. I have seen so many different providers over the years, but still occasionally have a little bit of PTSD. And most recently, that it was a surprise to me, is when a door swings, sometimes that can be a trigger of panic and other components that I'll start to feel emotionally. And that had been much better for a lot of years after a lot of brain-based therapies, but that has trickled back in the past month. So I don't know if there's something you can help on the emotional side.
That's interesting. So doors swinging, and is that just something recent?
In the past, that would actually put me into a full panic attack. It hasn't been to that degree, but it has been enough to notice an increase of heart rate, a little bit of sweat, just a familiar feeling that I don't want to go down that path, but just an awareness, I would say, has come back into my experience.
Okay. Is it just the swinging of the doors? Is it slamming of the doors? Like,
It would just be, for an example, I was in the kitchen and I just quickly opened up the pantry door, and it was just the quick sensation of that.
all right, interesting.
Yeah.
Interesting. Is it the sensation of the door, the sensation of the wind? Maybe getting the wind knocked out of you from your concussions, it brings that back to you.
Not that, it's
No?
something coming at my face.
Oh, interesting. Okay.
You know, like a soccer ball or somebody's elbow coming at your head, that kind of thing.
Okay,
Yeah.
that makes complete sense. Absolutely. And in the moment when it happens, what, with that racing heart rate, what do you do? Where do you find yourself after that happens?
Like I said, I noticed an increase of heart rate, a little bit of anxiety come up, but then it's just a reminder to take a deep breath. You're okay, you're safe, everything along that nature. But I just noticed that it's a little fatiguing afterwards then.
Okay. And your dietary habits, they're pretty good. I mean, 'cause
Absolutely.
it's all a
Yep.
whole, so we just want to make sure your water
Yeah.
intake's good, your diet's good.
Absolutely.
How is your sleeping?
Sleeping is usually 7.5 to 8 hours a night.
Okay, so that's pretty good, and I know that you're pretty active as far as exercise, correct?
Yes.
Okay, so what I could do is I would tap into your subconscious, and then we would use a muscle testing approach to release any emotions that maybe are still hindering from the concussions, from having something kicked at you in your face. Is that something I can do for you right now? I mean, is that something I could see if there is anything that we can release for you? In regards to the doors swinging, is that something that you're open to?
I'm open to it.
Okay, because again, we would tap in with your subconscious, because I'm using my emotion code certification. So as long as you get permission and you're willing and you're open, we could see if there are any actual trapped emotions contributing to the trauma of something coming at your face.
Okay, I'm open to that.
Okay. And we're gonna use muscle testing, and those that aren't familiar with muscle testing, we're using her own muscles, a kinesiology testing to get a positive yes or no based upon her subconscious, not necessarily her conscious. So if you can please give me a positive yes, a nice strong yes.
Okay.
Awesome, and then how about a weak no? Okay, so when she gave me a strong yes, she's holding her fingers together. It was a strong, I couldn't remove her fingers from each other, but then when I asked for a weak no, her fingers then became separated. So that shows that she's a strong testing person. I can test directly on her. So Maddie, are there any trapped emotions that we could release right now contributing to the trauma of something coming at your face? And the answer is yes. And then within that, I work off of an emotion code chart. So it aligns it out for me. So that first emotion, is that in column A? It's not. Is that in column B? That is. And then I would ask, is that an even row? No, that's an odd row. So that first emotion, is that in B2? Is that in B4? Okay, and I work so closely with this emotion code, so let's go ahead. Is this first emotion, is that depression? Is that frustration? Okay, frustration. So that makes complete sense. So this first emotion of frustration tied into the contributing of that trauma of something coming at your face. Does that all have to do back with your concussions? And it does, back to concussion days. So all that is very strong. And then Maddie, subconsciously, is this something that we need to identify more information about? And the answer is no, because her fingers are opening wide for me. And then the question would be, Maddie, can we release this energy for you? And the answer is yes, because her hands are closed, her fingers are closed. So in order to release the actual emotion from someone is I would go over their governing meridian, and that starts at the very bottom of your upper lip and it goes over your nose all the way over your sagittal marks through the top of your head, down your spine, all the way down to the sacrum. And I use a magnet because the magnet kind of moves the energy, which I don't have the magnet here, but we can also use your hand because we are full of energy. So what I'm going to do is just have Maddie connect to a light. And when I have her connect to this light, we're picturing this light coming in. It's a bright light, whatever color you want it to come in. And we're just removing and releasing the trapped emotion of frustration that was trapped from your concussion. And we're going to replace that. We're going to replace it with love. And we're going to replace that with compassion. Beautiful. So let's just make sure we remove that trapped emotion, and that trapped emotion of frustration for you, Maddie, is that now released. And that is her fingers are strong. So I know there's probably more emotions that we could release for her, but really, Maddie, what did you feel as I did that?
Definitely a lightness, a release that I wasn't aware I needed.
Okay.
Thank you.
You're
Wow.
welcome.
Love
Awesome.
it.
That's fantastic.
Well, that's a wrap. Beautifully done. And for those skeptics out there, this is a treat for you if you're willing to be open-minded and to discover this realm, because it's real and with major impact on people's lives. And the truth be told is that, once again, as I've shared many, many times, our bodies are a complex network of cells and organs, self-regulating systems. There's an intelligence within all this, the networks of information exchange that has evolved over millennia. And what that means is that it's all energy driven, and there's this ability, there's a consistency in that information. Those people who understand, Reiki images, what happens is that Reiki developed very specific images that impart very specific emotions, and people would question that. Well, how's that even possible? I mean, we're different people, right? Well, it's all about patterns, and when our brain recognizes very specific patterns, it's going to respond in a very specific way. And so all what Rachel is doing today is appreciating the different patterns, with all the training that she has, including the code that she's utilizing, which is consistent and universal for everyone, and tapping into that intelligence, with her experience, is able to impart these changes. And so once again, people think, well, how's that even possible? Well, it works, and it's all validated. And so what you do want to do is make sure that you have somebody who is truly qualified, like Rachel is, and just you can hear the integrity of her work. And I just have to point that out, because there are many out there that don't have that. They think they're doing it, and all well intended, and no judgment against them, but they're actually doing the wrong thing. Whereas clearly Rachel has the training, has the integrity, and has the ability to do this at a most beautiful level. Me, myself, being trained in this field, actually felt the work that she was doing today. So that was a beautiful thing, both of you. What was present for you? Let's start off with Maddie this time. What was that all about for you? And then I want Rachel to share with us what was present for her.
Yes, I was honestly surprised, to be honest with you, because I didn't really know what we'd be coming up with today, to talk about. But when we first moved to Florida, it was my 7th documented concussion. And I happened to be in a brain-based center it was all different integrated professionals. And I was blessed to be able to do 30 hours a week for 2 years. I did brain-specific rehabilitative training and a lot of biohacking. So we went through full detoxification, methylation pathways, epigenetics to really heal the body after all the concussions so that they didn't turn into long-term brain issues for me. So I was surprised to kind of start feeling some of this in the past month. So I really had thought I was, fully done with that chapter. So it was a surprise to me that, there's always something else sometimes beneath the surface, but I guess I wasn't ready to let it go until today. So
Love
thank
it.
you. Yeah.
Rachel, what was present for you?
Absolutely. I love doing energy work because I really can feel it from someone. So when I work with someone, I feel their energy. I don't absorb it. I'm very conscious about that. I have my boundaries, but like to be able to fully feel that frustration be removed from someone and allow them to feel lighter, like it's just, I love it. Like there's nothing I would rather be doing. Like I feel empowered. I feel connected. I feel love. I feel whole when I do that.
Awesome. What else do you want people to know about energy work? And so some people might be, critical of, this muscle testing. And quite frankly, I was one of those. I come from a very scientific and academic background, and I was also very, very skeptical. And, whenever somebody would muscle test me, I would say, well, you're just pushing harder. That's why you're doing this. But I routinely go to a body worker to make the adjustments. He's doing muscle testing on me all the time, and I'm recognizing he's actually responding to my energy systems. But what do you want to share with people who are really seriously thinking, you know what, I need this work, and how do I find out more about it, and what should I be looking for?
Absolutely. You definitely want to make sure someone is certified and has trained in it and are coming from a heart-centered place, because if not, as Bart mentioned, that could be not fatal to you, but I mean, it's not helpful to you. It might harm you in the long term. And just once you find that person to connect with, whether it's in person, you could do it online, you could do it over the phone. Like once you really, your energies connect with that person, with that energy healer, I mean, the transformation that you'll go through, as long as you stick with the process, even if at first you don't really understand the process, but you feel something, not sure what it is, stick with it for a couple different sessions. I mean, it's going to take a couple to release the energy that you have stagnant, but really stick with it, and you'll just find yourself living happier and healthier and in more joy, and just coming from a better place and a more kinder place to yourself and to others around you, really.
What else is present for you, Maddie, in regards to your whole concussion and that experience?
You mean after kind of the work that Rachel just did?
Mm-hmm.
Definitely a lighter feeling. Like I said, I didn't realize I was carrying that frustration around. Type thing that wouldn't have been the first emotion that I would have identified with kind of feeling that the PTSD component. But it made perfect sense when she was going through the different emotions that it could have been. I'm a little blown away because, like I said, I had done so many years of that specific therapy and the brain mapping and all, you name it. And it was all great work, not disregarding that by any means, but it was just a good reminder that the work is never done, and that's a totally okay place to be, but that it's always a continuation.
Yeah, and again, I think some people are either cynical or skeptical about PTSD and all that, and kind of wondering, well, are we creating a bunch of snowflakes in the world today?
Right.
Did we have these problems 50 years ago? I mean, we had major wars, that people have all these things, and the truth of the matter is they did. And the other truth of the matter is simply this, is that we've got the genetic blueprint of a perfectly functioning body. But within that blueprint, there are things that don't operate, well. One of the genes, for example, is the methylation gene, and about 50% of the population have a deficiency of that activity, which then can cause all sorts of problems. And so what does that really mean? How does that translate in our world today? Well, when you think about the fact that we are exposed in excess of 200,000 different toxins every single day, and these are just the chemical ones. And then you think of all the media toxins and the people toxins and every other toxins, and then all the other bad decisions you've made over life.
Yes.
Clearly your cells are not going to be optimally functioning.
Yeah.
And so what does that really mean? Well, based also on your programming, and just think of it this way, we're just a dynamic computer system based on all the learnings that we've acquired over years. Again, different events are going to have different impacts on us. And so PTSD is certainly a very clear, a real issue. It's no reflection on the weakness of any kind of individual. It's simply a reflection of a conglomerate of impact or influences on the body that's going to cause the brain to work in a certain way. I mean, just bottom line is this, is that if you're intoxicated with alcohol, your body's not going to work and your brain's not going to work. Well, sometimes what happens because of all these outside influences, the biochemistry of your brain gets kind of messed up. Again, no weakness, no fault of yours. But the key is, as Rachel basically said, how do you get to feel afterwards? And having a happy life, peaceful life is what we all desire and deserve. And it's a matter of how do we get there? And so part of it is let me rephrase that. Well, most of it is actually self-responsibility, taking, ownership and action step. And this is unfortunately what's very much lacking in today's world, but also finding the right people, like Rachel and Maddie, who can support you and guide you. And ultimately it's about, finding them trustworthy. You've got to decide if they're coming, from the heart. You've got to discern, is this real, or the red flags? And then ultimately, are you getting the results or not? And so once again, I know that the work that you guys are doing is absolutely amazing. I love the fact that you are combining it all together, because my belief again is it's about stacking all of this. Because if you're just doing structural like many chiropractors do, or if you're just doing energy work like many other energy workers do, you got to work together. And that's actually my mission statement for most people out there, is that it's creating space for generative collaboration. I'm giving the mic back to both of you as to what else you would like to share about anything that we've discussed, what's present, what do you want people to know?
Ooh. My takeaway is that, kind of like what you mentioned, that prevention and intervention can happen at the same time, and just putting, fresh eyes on that, and looking for the right providers or the right way that you can get the self-knowledge, and then taking that responsibility, because self-care, it has to be implemented daily, and we're all responsible for that for ourselves.
Great. Rachel?
I would have to say, not necessarily a takeaway, maybe a takeaway for everyone else, that if you don't connect with a specific chiropractor or energy worker, don't say it doesn't work for me, just try to find another one. And you might have to go through 2 or 3 until you find the one that you connect with. But it's not that that profession doesn't work, you just don't energetically work with that professional. So just find the right professional, but don't give up on it.
Awesome. All right, Rachel, how do people find you?
You can find us. We are at Balanced Body Center. We are over downtown Sarasota, right across from the Selby Gardens. Our website is balanced with a D, body, SRQ, at gmail.com or balancedbodysrq.com for our website. But I think that's it. Yeah.
Absolutely.
So you both work there, so that's how we get a hold of you, Maddie.
That is correct, yes.
Excellent. Well, I want to thank you both. What you guys do is amazing. You're a dynamic duo, making many people's lives so much better. And we need more people like you. My name is Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. And my hope is that you are leaving with some very specific insights, maybe some new awareness about what's actually possible for you. Maybe you've been trying some things that haven't quite worked out, and it's either because it's not the right fit energetically, you're not aligned, or maybe there's some more things that need to be worked on at the same time. Here's the truth. When something is not working well, usually it's a multitude of factors, and unless you begin addressing enough of them, you're not going to make the shifts that you need to make. And so that's the future of health in this world for us today, as I'm promoting on so many different levels. How do we stack up? How do we find the right people? How do we create a team to help us optimize ourselves? Thank you, and we will be back.